Hi there. Apologies for the earlier recording, but I do have a puppy at home and she's more liable to nap in the morning than the afternoon. So I figured it would be safer for us to record this beforehand. But without further ado, let's get started. So today we're going to be spending some time talking about reducing isolation among our aging adult population, and how telehealth can be a tool to help us do that. So let's get started. Just our standard disclaimers. And quick explanation of who we are at the Upper Midwest Telehealth Resource Center. If you've attended a UMTRC event before, or if you're familiar with us, I promise to keep this spiel short. If not, welcome. We are delighted to have you joining us today. We'll give you a quick overview of who we are. So, the Upper Midwest Telehealth Resource Center is a program of the Indiana Rural Health Association, and we are going to be your primary telehealth TA contacts for the state of Illinois, Indiana, Michigan, and Ohio. So we're a bit unique in IRHA programs in that we do cover multiple states. We're based in Indiana, but we cover all four states in our region. And we are part of the larger national consortium of telehealth resource centers for one of your regional ones. And no matter where you are in the United States or the territories, you do have a TRC covering you to assist you with telehealth education, outreach, technical assistance, all that good stuff. So here's a map of the TRC program all over the United States. We also have two TRCs that are focused more specifically on technology and policy, and those cover the whole US. But we do work collaboratively as a consortium. We're separate organizations, but we work together to provide technical assistance, education, and outreach to all of our stakeholders. So, to put a finer point on it, what exactly do we do at the UMTRC? So, our bread and butter, the thing that we were created by the Office for the Advancement of Telehealth for, is technical assistance. And what that means is that there's a lot of folks out there who have questions about telehealth, and we do our best to answer those questions. So, these questions can be anything from really specific stuff like, how do I utilize this specific code, billing code, in this really specific circumstance in my state, to things that are incredibly general, like how do I start a telehealth program? Or we've gotten ones before that are what is telehealth? So we really run the gamut on technical assistance questions, and we have a large network of folks who can help you get connected with resources and all that good stuff. We also do a lot of resource creation ourselves, and this includes making a lot of toolkits, fact sheets, newsletters, blogs, all that good stuff. If you have a question about something, we probably have a resource for it. And if we don't have a resource for it, you're probably not the only person who would like one. So let us know. We also do webinars like this one today, podcasts, blogs, other engagement resources as well. So we really aim to be like your hub for all things telehealth. So, a couple examples of resources that I think are really helpful and that I like folks to know about from the UMTRC are reimbursement guides. These are fantastic. We work with a contractor every year to come up with these for all four states in our region for telehealth reimbursement, not just for our Medicaid, Medicare, but also for our most common private insurers in every state. So, if you have a question about whether or not something's covered, these reimbursement guides, which are available to download on our website right now, are a really good option. We also have a number of telehealth toolkits. I believe we have 8 at this point that really go in depth on more specific telehealth topics. Like, for example, we have one about telehealth and AI use. We have one about remote patient monitoring, one about remote therapeutic monitoring. They're really great, and I recommend you check them out if you're curious. I don't just say that because I wrote the majority of them. We also do a lot of telehealth webinars, like I said, and we have those backlogged on our YouTube page. So if you didn't get enough of telehealth talk today, we do have a lot of those for you to go through. So, now that you know who we are at the UMTRC, let's talk about some of the questions we're going to be answering today in this presentation. So, this is going to be pretty high level because there's a lot to get into with how social isolation and loneliness impacts folks and about how telehealth can help combat it. But we're going to try to keep things focused. But the questions we're going to be answering today is what is the impact of social isolation on aging adults specifically? Then we're going to talk about how telehealth can be used as a tool to help us build virtual community with aging adults. And we're also going to go a little bit into how wider telecommunication technologies, remote telecommunication technologies can be used in this kind of way. And then we're going to talk about how we can connect with our communities to do this. So, without further ado, let's get started. So, we're going to start off talking about social isolation in seniors and how this differs from garden variety loneliness and how it's the same. So, first up, let's talk about whole person wellness and why it matters. So, whole person health or wellness involves looking at the whole person, not just individual organs or body systems. Like looking at whole person wellness isn't just saying, oh, I have a broken ankle. It's looking at the whole body and seeing how it's doing. So, one thing to note here is that it's not just one of these factors that's going to impact a person's health. It's all of these things working together. So, loneliness and social isolation, excuse me, are going to be shaped by more than just someone's physical health or mental health, behavioral health. There's going to be a lot of different stuff that's going into that. So, loneliness and social isolation aren't just going to be shaped by one thing. They're going to be shaped by conditions in the environments where people are born, live, work, worship, and play. So these conditions can affect the ability to connect socially. For example, the availability of resources that exist in communities such as parks, libraries, public transport, and programs are going to support the development of social connections. And I would be remiss, we're a rural health agency, I would be remiss not to note that rural communities have a lot of challenges that relate to loneliness and social isolation. There's going to be a lack of some of these community resources and a lack of availability of things like public transit and easily walkable communities in most cases. So, a lot of what we're talking about today is going to apply really heavily to our rural communities. So, another reason why it's important to talk about. And I'm sorry for the wiggling. I didn't know it was going to persist through the whole slide. But let's talk about social isolation versus loneliness and how they're different. So, social isolation is going to be a condition in which individuals are going to lack adequate connections to family, friends, or like a larger community. So, loneliness, in contrast, is going to be the subjective feeling of being alone. So people are going to prefer different amounts of time with others, and individuals can be alone without feeling lonely. I'm an introvert, despite my ability and love of yapping. So spending time alone for me isn't necessarily going to lead to loneliness. So alternatively, there are individuals who can be surrounded by people and still experience loneliness. So, in general, the risk of loneliness, though, is going to increase with social isolation. If you don't have community or close friends and families that are easily accessible, that is usually going to lead to loneliness. So, social isolation and loneliness were recognized as increasingly prevalent public health risks during and after the COVID-19 pandemic because of all of our stay-at-home orders, just a lack of connection. So this is something that was really heavily sort of identified during the COVID-19 pandemic, but it has been a problem before that. It's a problem after that. It's a continuing issue. So one thing to notice when we're talking about social isolation, there's a kind of a scoring matrix that's used sometime. And the factors that are going to go into it are things like marital status, your living arrangement, your monthly communication with your children if you have them, or your larger family, your monthly participation in groups, clubs, organizations, or religious services. There's a lot of different things that are going to work together to either ensure someone is not socially isolated, or there's going to be a large lack of those things. And when that's happening, yeah, we see people who are more socially isolated. So I am a data nerd, so I'm going to get into the numbers for just a minute. I promise not to belabor, but something that's important to note is that this is a uniquely focus thing on our aging adults, our senior populations. So 16 million older Americans, and the data I got this from is defining older Americans as 60 plus. But 16 million Americans do live alone. 43% of American women over 75 live alone, which this was a very shocking statistic to me. I was like, wow, that's a lot of people. Uh, in contrast to 24% of American men over 75 that are living alone, but still a very large portion. 80% of people over 65 who live alone are widowed or divorced, so they don't have a partner or a spouse. 20% of Americans over 65 who live alone are under the federal poverty line. So, something to note when we talk about this, and we'll go into this more later, is that a lot of these folks are also going to be financially disadvantaged. So, that's something that is going to play into social isolation. And some more significant numbers, 37% of older Americans, and again, this is reporting those over 50 because that's the data that was available. I know we usually say over 65, but but around 40% of older Americans are reported as feeling lonely. And this is self-reporting. So generally, when we're talking about self-reporting, particularly with something like loneliness, isolation, things that have stigmas attached, the actual number is going to be quite a bit higher. But this is the percentage that did self-report this. And then 34% of older Americans reported that social isolation. So this is not an insignificant amount of folks that are suffering from this social isolation, this lack of connection, which, as we're going to talk about next slide here, has a significant negative impact on overall health. So, first thing to note, people who are socially isolated or lonely are going to be more likely to be admitted to an emergency room or a nursing home. So, this is something that is going to affect people very personally, but it's also going to affect our larger health ecosystem because we know that admittance into emergency rooms, admittance into nursing homes, those are going to be significantly expensive costs for those individual folks, but then also for our larger healthcare system. So social isolation is something that is costing people their health, but it's also costing our larger healthcare system a lot of money. And these are additional consequences. So, folks, when we talk about these people, it's aging adults, older adults, folks who are socially isolated are going to have higher risk for high blood pressure or hypertension, heart disease, obesity, weakened immune functions, anxiety, depression. So, we're talking about these long term chronic health issues like our hypertension and like our heart disease, but we're also talking about behavioral and mental health issues like our anxiety and depression that are really going to affect people's day-to-day lives and their lived experiences. So this is something that's affecting people in a very personal way. These are real consequences. So, what can we do about it? And something I want to know, as I always note when I do presentations talking about these large scale problems, is that the solutions we're talking about today are one, not one size fits all. I'm proposing solutions and opportunities, but I don't believe these are going to be a silver bullet. This is not a panacea. I love telehealth, as you can tell by my I love telemedicine shirt. But it is not going to be the only thing that is going to need to improve or be implemented to solve these problems. So that's something that's important to note. And also, sorry, not every solution is going to work for every person. Telehealth doesn't work for every person. It's not going to work for every specialty. It's not going to work for every condition. So we're talking about some of the things we can do, but these are by far not the only things that we can do. So let's talk about how we use telehealth and telecommunications technology to reduce isolation. And we're focusing on aging adults today because this is the population that has by far the highest risk of this and by far the highest reported numbers. But any population can utilize telehealth and telecommunications technology to reduce isolation. So let's talk about some telehealth opportunities that can be utilized to really help to reduce our isolation, our social isolation, and our loneliness. So, group therapy is a big one, and we're going to get into some real world examples in a couple of slides. But instituting group therapy, so folks who are struggling with that social isolation are able to connect with others, maybe in similar situations, can be a fantastic way to help keep people from really falling into that loneliness and help folks who are already socially isolated maybe form connections. So, mental health services are one that can be big. Like we said, social isolation and loneliness can really contribute to higher rates of anxiety and depression. And those are things that we really want to address. So, mental health services have been kind of since COVID-19 are really our shining star of telehealth. They just lend themselves really well to being delivered through a telehealth format. And there's also the lack of a stigma that sometimes goes along with like receiving care through a computer rather than in person. But this can be a great way to sort of mitigate some of those harmful symptoms that come along with the isolation, the loneliness. So, one thing to note is that, and we're going to talk about this in a couple of slides, but technology can be a barrier for older folks, not to generalize. My my older family members are fantastic at technology, no more than I do in some cases, but trends suggest and statistics suggest that older adults are less comfortable utilizing new and advanced technology in some cases. But with telehealth, there are low tech opportunities. Audio only appointments are going to be an option in a lot of cases, particularly in our more rural communities. So don't think that just because someone isn't comfortable with turning on their computer and going to a website or whatever, that there's not an option for them to utilize telecommunications technology to assist in reducing loneliness or receiving care. And then education and outreach is a big one. When we think about telehealth, a lot of the time, we think about sitting down and going to, as again, my older family members call it, going to the doctor on the computer. But it's more than that. It includes education and outreach, like doing education sessions through telehealth is an option. Doing outreach sessions, connecting folks with resources and services that are outside of their geographic area. There's a lot of ways that we can utilize telehealth creatively to help get folks connected with our education and outreach tools, which is great. So, this is moving away from just telehealth a little bit, but I think it's something that's really important to note. So, telecommunication technologies are going to be able to serve as a tool for creating virtual spaces to build community. And this is something that is increasingly common among younger folks, but has a lot of potential among our older and aging adults. So, a good example of this is there was a program instituted called Circle of Friends. And we'll talk about that next slide here. So there was an issue here. So Circle of Friends was a program that was implemented to help older adults, aging adults, become connected with other folks in similar situations in their community. So when this was first implemented, it was an in-person thing. It lasted for like a discrete period of time, but the goal here was to get older adults really connected with other folks in similar situations throughout the community. So they would go and have like outings to museums, things like that, go to talks and presentations by people. It was just like a social group to help folks who were isolated really connect with other people. And despite the fact that it was a like discrete amount of time, it lasted for like a couple months, couple weeks, I forget, but a lot of times these people would build connection with each other and continue to meet afterwards and continue to have relationships that would help with social isolation. So there was a problem that was run into during COVID-19 because in-person restrictions meant that older adults, the folks in these Circle of Friends programs, were not able to connect. They were not able to meet up. And so there was a lot of loneliness, a lot of isolation. So what the program did is that they instituted telecommunication technologies to continue the Circle of Friends programs. So maybe they weren't going to a museum. Maybe they were watching a documentary together online or something, or they were attending like a Zoom presentation with a museum curator, something like that. Like there were a lot of different ways that they were able to creatively find solutions and ensure that folks were still able to connect with each other socially. So it ended up being successful enough, and social isolation and loneliness ended up being enough of a problem in our older aging adult communities during COVID-19 that this is something that was expanded beyond its initial reach pretty far. So the interventions were continued because like this was something that was based on intervening when folks were dealing with that social isolation, that loneliness. And it eventually expanded beyond its initial scope because it's a lot easier to expand a program to additional locations if you're utilizing telecommunications technology, because you don't need to have like a physical center in a new city. You can just connect via the internet. So it's something where it ended up being a big success, and it continues virtually to this day, connecting people, older adults, and ensuring that they have a way to connect with others in similar situations and really fight against that loneliness, that isolation. And something that came from this is that, and this is next slide, sorry. We learn to adapt in some cases going from our in-person communities to our virtual communities. And this is something where, yes, there's going to be some growing pains. And yes, it's not going to always going to work correctly the first time. Some people aren't going to like it. It's going to take adjustment, but it's a really great tool. And we found this during COVID when there really wasn't another option. But even after we've gone back to doing more things in person, things like that, this has continued to be something that is a really good tool and a really good way to form community for folks who may not have an option in person. Like I said earlier, folks in rural locations where they just don't have the infrastructure to have these kind of programs can have it online because they don't need to be within driving distance or public transit distance of a museum. They can just hop on their computer, hop on their tablet. So let's talk about some more ways that we can specifically support aging adults with our telehealth technologies. It's time for a background change. So, different aspects of health can benefit from accessibility and access to telehealth among our aging adults, our older populations. So, first of all, mental health. Like I said, mental health is something that lends itself extremely well to telehealth practice. And mental health is something that can be really neglected and overlooked in our older populations and in our populations that have maybe some stigma, some judgment around mental health therapy, mental health treatment. So group therapy can be done pretty effectively, and this is a way that we can mitigate, combat loneliness. And then general behavioral health appointments and care can be delivered through telehealth. And for the most part, these are going to be like fully billable. This is one of those ones that there hasn't been a lot of contention around making this billable just because it's been able to be delivered so effectively. And then, like I said, telehealth goes beyond just in person kind of telehealth goes beyond just the doctor on the computer sort of model. There's going to be education sessions and connection with community assistance, all that good stuff. And that's always so great. So physical health isn't one you would necessarily think of at first as being really effective in being delivered through telehealth. But we found during a lot of this, we found during the COVID-19 pandemic, just because we were forced to be creative, physical therapy can be delivered through telehealth pretty effectively, not in all cases, but particularly when we're looking at rehabilitation from like a knee replacement, a hip replacement, whatever. That can be delivered through physical therapy pretty effectively. So and we can also facilitate in-home exercises where possible. This is something that the Circle of Friends people did. They did like weekly Pilates classes, things like that, where they were really encouraging physical health. Because, like we saw a billion slides ago now, obesity, hypertension, heart disease, those are things that are all if you're living a sedentary lifestyle, those are risks. That's a risk towards that happening. And if we're encouraging physical health and physical wellness among our seniors through these telehealth tools, that's a way to mitigate that risk or at least lessen it. So, and then last but not least is social health. We can adapt our in-person social groups to exist virtually. So we're not missing out on the ability to connect with others in our social group. Wellness calls is also something that was suggested, doing wellness calls with like a digital navigator or a caregiver to just check in and ensure that someone is okay. I'm sure that we all have an older relative we do this with, like our wellness calls, but doing this in a more standardized way through our telecommunication technologies is an option. And like I said, connection with existing family and friends, that's something that can happen through telecommunications technology. And once you get the hang of it, once our older adults get the hang of it, it can be really effective at fighting that loneliness. We saw a lot of this during COVID-19, providing older adults with like tablets, teaching them how to use Zoom, things like that, when they were able to, despite the fact they maybe hadn't seen their grandchildren in person in a year, they were able to check in with them pretty frequently. So a lot of good ways that telehealth tools can be utilized to promote all kinds of health. Okay, so let's talk about some of our key benefits from utilizing telehealth tools. So this one is a no-brainer, and it's true of all telehealth delivery, not just what we're talking about today. There's always going to be an increased access to care when we're talking about utilizing telehealth. There's more providers available via telehealth than there are in like your drivable radius, or if you're an older adult who maybe doesn't have public transit available within your walkable or radius, something like that. So you're just able to connect with a lot more providers this way, which is great. And this is something, like I said, a lot of these issues are going to be exacerbated in our rural communities. Our rural communities are just going to have less access to healthcare providers within the community, particularly specialists. Like, and if I'm an older adult, a lot of times I'm going to have more complex health needs. If I need to go see an endocrinologist and I'm in a rural location, that's something where I'm probably going to have to drive a couple hours. But if I have telehealth access, maybe I'm able to connect with that specialist via telehealth, and then I just have to drive like 20 minutes to go to a lab or something like that. So it's increased access to care can really help folks. And like I said, this goes along with the more opportunities. There are more ways to receive care if you use telehealth as a care modality. And I mentioned this earlier, but I think it's really important to hammer home, particularly when we're talking about this community. Low tech options are going to be very available. You have your audio only. You're able to access a telehealth appointment through like a tablet or a mobile phone, which a lot of these folks do have. And then last but not least, and this is something I could do a whole presentation on by itself, maybe I will, is chronic care access. So our older adults, our aging population is going to have higher chronic care needs. We talked about this a couple slides back. There's those higher risks for things like hypertension, heart disease, things that are going to require regular appointments, regular monitoring. There's going to be more needs for medication. We're going to have to monitor that. And something that's important to note is that remote patient monitoring and remote therapeutic monitoring delivered through telehealth can be such a boon and such a helpful way to get folks connected with care. But you have to be connected, you have to be comfortable utilizing the technology to do it. So, this is a great way that telehealth can be used to help manage long term chronic conditions, but there has to be a level of comfort there. Okay, next slide time. Okay, so what is going to stand in the way of us utilizing telehealth as a connection tool for our aging adults? So, first of all, and this is one we're going to talk about in depth on a further slide, digital literacy is going to be a concern. So, What's digital literacy? Long and short of it is it's how comfortable you are utilizing technology, how much knowledge you have. So I would consider myself as someone having high digital literacy. I've used a computer and a cell phone since I was in like my early teens. But some folks aren't comfortable utilizing technology. They haven't had the access, they haven't had the experience, so they have a low level of digital literacy. And if you have a lower level of digital literacy, you're just going to be less likely to utilize telehealth tools, which makes sense. And something to note with digital literacy, there's the digital divide between urban and rural. Folks who are more urban, folks who have higher economic status, that kind of thing, they're going to be a lot more likely to utilize digital resources and to have that knowledge regardless of age than are folks in rural populations. So this is another one that's going to be worse in our rural locations. Broadband and mobile is another one too. So broadband access is an issue in some of our rural communities, but low cost broadband access is going to be an issue across the board. Even if broadband is accessible in your area, that doesn't necessarily mean that you're able to pay for it and you're able to utilize it successfully. And that's the same for mobile networks as well. I might just not have broadband. And if I don't have broadband, I can't use telehealth. So, technology access is another one. This goes along with digital literacy, but it's just not having access to devices. If I don't have a computer, if I don't have a tablet, if I don't have a smartphone, it's going to be really challenging for me to utilize telehealth. And then, stigma, last but not least, a lot of what we're talking about here involves mental health, involves things that maybe folks aren't necessarily comfortable addressing. So, keeping stigma in mind is important when we're talking about this. So, our digital literacy challenge, and this is something that's important to highlight because it's going to be a big, big barrier to utilizing telehealth and just to utilizing telecommunications technologies in general for our aging population. So, some older adults aren't going to be comfortable with this. And one thing that is important to know, and I think I mentioned this before, but if I didn't, older adults are not going to be a monolith. The skill with technology is going to vary pretty greatly. There are going to be some older adults who are like, I have never been online. I don't want to. I don't think it's necessary. It's not something I want to do. But then I'm sure we all know that older person that's very comfortable with technology, uses it all the time, has more skills than we do. So it's something where there's a lot of variation, but following the statistics, our older population are in general going to be less familiar and comfortable with digital literacy overall. So technology in a lot of cases is going to be used as a caregiving tool, but if someone's not comfortable with it, they're not going to be able to use it effectively. And last but not least, not the focus of this presentation today, but digital literacy is going to be heavily impacted by disability status. Folks with hearing or visual disabilities are going to be a lot less likely to successfully utilize technology because a lot of the resources that they need are not easily accessible. Then economic status is another one, as well as educational status. Folks who are poorer are going to have less access to technology, generally speaking, and folks with lower educational attainment are, again, generally going to be less comfortable utilizing technology. Oh, whoops, I skipped my numbers. Okay, so some more relevant statistics here talking about one, digital literacy, and two, technology access. So, 1 in 3 older adults were reported, this was from an AARP study from just this last year, so pretty recent. 1 in 3 older adults are not confident in their digital literacy skills. And that number goes up the older population you look at. So overall, it's 1 in 3, but if you look at like 75 plus, it's more like 2 in 3. So 61% of Americans over 65 have access to broadband at home. This is significantly lower than our overall averages, which is something I think in the high 80s. 64% of older adults don't think technology is designed with their age in mind. So they don't think that new technology has been designed in a way that it's easily utilizable, easily utilized, excuse me, sorry, by an older population. And then we talk about emerging technologies a lot in the digital health space. So generative AI, that kind of thing, chat GPT, all that. Only 9% of older adults at the time this study was taken have reported as utilizing it or really being familiar with it. And then only, this is one that I think is really significant, only 13% of older adults use technology to manage chronic conditions. And this includes things like utilizing remote patient monitoring devices. So there's a lot of missed opportunity here, in my opinion. So, what are some of our common challenges for technology access? So, access is going to be just as important as digital literacy, like I said. Um, if you don't have technology, regardless of whether or not you're comfortable using it, you're not going to be able to use it. So, something to note here is that there are certain types of tech, namely e-readers and tablets, that are going to be more common with older adults due to physical considerations. It might be hard to look at text on a cell phone, but a tablet or an e-reader is going to have a lot more space. It's going to have a lot more options to make that text real big. So when we're talking about technology among older adults, we want to make sure that the technology we're talking about is accessible. Once again, economic status is going to play a major role here. We said earlier there's a disproportionately high number of older adults that are going to live below the poverty line, and a lot of them are on fixed income, so they're not going to be able to like splurge for the newest bit of technology because they just don't have the access to the funds to do that. So there's lack of low cost options here. And there's also, in some cases, a dislike of new technology. So they're going to continue to use their Microsoft Edge and their Nokia brick for as long as they can. And hey, I respect it. So, something to note here, there's an emerging trend of community health workers being trained to be more familiar with our digital tools and our digital health technologies. We call these people digital navigators in a lot of cases. And their main connection or their main goal here is to provide resource connection. So, maybe to help older adults pay their power bill online or something like that. And also to provide telehealth assistance, help someone get set up for an appointment, explain how it's going to work to them, and just to help them be included in this larger realm of health technology and technology overall. It's something I did a presentation on it a little while ago. Health internet is largely being called, not largely, but it's increasingly being called a super determinant of health just because of how prevalent it is and how many different aspects of our health it impacts. So it's everything from education to work to play to health. Like there's a lot of places where the internet has become super relevant. And if you don't have technology literacy, if you don't have technology access, you're going to miss that overall inclusion, which is really going to lead to more isolation overall. So, just a quick explanation of the evolution of digital navigators. This has really happened since the pandemic, and we've just seen how prevalent and important digital health technology is. So, another note on ensuring that challenges are met. Accessible tools is a big one. So if you are, your organization is implementing new technologies, it's important to ensure that those technologies are going to be accessible by everyone who's going to be using them. And that includes our older adults. So they need to have that accessibility. So they need to have the ability to like make text bigger or smaller. They need to be easily understandable. The tools and practitioners should complement each other with this. One, you should have easily usable and accessible tools, but then you should also have practitioners who are able to provide that technology basics and support during other visits. We do presentations sometimes about website manner, and if you're curious about that, I would recommend following along for those. Okay, so quick note on making accessible tools. The 4M framework is something that we've seen discussed in ensuring that health systems are age friendly. So, first of all, why it matters, folks need to understand, and the M is the in matters is the one for this one. But why it matters, folks need to understand why the technology they're using matters and why they should invest their time in it. So, another part of why it matters is ensuring that the health outcomes align with that patient's. Next, mobility. We're going to want to encourage mobility and access, medication, understand why they're taking the medication and that the medication being utilized is appropriate. Um, and then a mentation. Oh, so sorry. So sorry. Mentation is going to apply to our mental health and ensuring that we're checking for things like dementia and Alzheimer's. Those things are being addressed appropriately, but also that we're addressing things like anxiety and depression. So, this is not the end all be all, but if you're looking at how to make an accessible health program, consulting the 4M framework isn't a bad place to start. So, when we're talking about ensuring access, an important thing to do is know who our allies are, know who needs to be on the same page here. First of all, caregivers are a big one, particularly when we're looking at caregivers of an older age. A lot of times, not ability, but frequent technology usage in managing care dips pretty precipitously when we talk about age. So caregivers who are 50 and up are going to be a lot less likely to utilize digital health tools, telehealth, to help do their job than those who are younger. So we want to make sure that digital health tools are accessible, not just to our older adults, but to their caregivers as well. I mentioned digital navigators before, but they're going to be such a useful resource. And then our larger support systems around our aging adults, we need to make sure that their family members also have the support to help them with this. Like, so education shouldn't just be available for our older adults, it should also be available for their family members and support systems. And last but not least, providers should be on the same page too, obviously. Okay, so a good real world example here, and this is, I looked at a couple studies, but, and this is something that we saw in practice during COVID-19. So during COVID-19, a lot of older adults were extremely isolated due to stay at home orders. And this is something that was really, really prevalent in our aging older adult population because COVID-19 was, they were high risk. So they really were encouraged to stay home. So a telehealth solution that we saw, there was a university and community program in Florida that partnered together to provide older adults with technology and education to connect with telehealth. So they weren't just saying, here's a tablet, figure it out. And they weren't just saying, well, you should use like telehealth technology and not giving them access. They gave them the technology they needed to connect with telehealth. And then they gave them the education they needed to utilize these tools. So the tablets were preloaded with educational information and like the apps they needed to receive care. And they were used successfully. They looked at this study, what the tablets were used for, and they were used most commonly for telehealth. But they were also used to connect with family, community organizations. So among the 44 patients that received the tablet, like 10 of them, so 23% did report utilizing it daily. So it was something that they were able to adapt to and able to utilize pretty successfully. So our last section here, and I'll try to keep this brief, I know we're running short on time, is community-based approaches. So, when we are coming at this from a community standpoint, first things first, we got to identify who our relevant partners are. So, good examples of relevant partners senior centers, they're already going to have access to the population and they have the infrastructure. Faith-based organizations, they're trusted partners in the community, and we see a lot of older adults statistically engaging with faith-based organizations. Public health organizations, they're going to be subject matter experts here. And then public libraries is a big one. So in the telehealth space, public libraries are great at being telehealth access points and at partnering to ensure that there's like stable broadband. And this is great in rural communities because a lot of times the only place in a community that's going to have stable broadband is going to be a public library. So, our last real world example, this is going to be pretty similar to the last one. So, during COVID-19, we saw many older adults couldn't use telehealth technology, but the Little Brothers Friends of the Elderly organization in San Francisco worked with their older adults to increase not just like their telehealth know-how, but their overall technology literacy. They taught them how to check their email. They taught them how to Google search, like all this stuff. So they identified older adults who did have Wi-Fi, who did have the technology available, and then volunteers trained them how to utilize technology overall, but also for telehealth. And they found that the older adults showed increased independence and confidence in using technology overall, but also for telehealth. They reported, and afterwards, they reported improved health, social benefits, and really appreciated that they were able to be trained by these volunteers. So, just another example of how telehealth or how community organizations were able to partner with folks to help our older adults become more proficient with technology so they could utilize telehealth. So, this is something I do want to note. So, one of our fellow TRCs likes to use the phrase nothing about us without us when they're creating new resources. And what this means, like the basics, are that we shouldn't be creating resources about a community without engaging that community. So, when we're talking about integrating telehealth, we need to make sure that we have older adults, aging adults at the table, and we talk about them about what they want. Like I've said before, they're not a monolith, but we want to make sure that we're engaging folks from that community. We're hearing from them and we're changing things based on what they're saying. So, last but not least, how do we ensure a sustainable program? So, we want to start making things human centered. We want to work with our community to implement. We want to try and seek sustainable funding, oftentimes through partnerships. And we want to continuously evaluate any program that we're implementing and find places for improvement. We also want to find places that are working well so we can ensure to keep on working well. So, our key takeaways from today: social isolation among older adults is a real problem. It is detrimental to physical health, emotional health. It's not good. But there are many ways that telehealth and telecommunications technologies can be used to help. And then, our last but not least, our solutions should be community based and work together to help our older adults become connected. So, last but not least, here are all of our connection points at the UMTRC. We have our website that has a lot of resources on it. We also have all of our social media here. We have our YouTube channel where we upload our old webinars a day or two after they're presented. And then if you have any questions and you don't get the opportunity to ask them today about this presentation or about telehealth overall, we'd love it if you could email us at info@umtrc.org and we will get back to you with your answers. Regardless, I'm going to turn it back over to present day me to finish this up. But thank you so much for your attention today. Really appreciate it.